Good afternoon, everyone, and thank you so much for joining us for a very special Ask the Experts Facebook Live for Head and Neck Cancer Awareness Month. We have three of our Moffitt Cancer Center experts from our Head and Neck Clinic here today to answer all of your questions and to share the latest on this topic. I want to remind you that as we're chatting, you're more than welcome to drop your questions and comments into the comment section below the video, and we will do our best to get to all of those towards the end of our conversation. Today, joining me are, as I said, three of our experts. We have Dr. George Yang, who is a radiation oncologist, Dr. Kedar Kurtani, who is a surgeon in our Head and Neck Clinic, as well as physician assistant Melody Matthews. Thank you, all three of you, for taking time today to talk to me. I appreciate it. Before we jump into the questions that I have for the three of you, those of you watching, I just want to remind you that we cannot offer personal medical advice or make any diagnoses over Facebook. And remember, anything you ask or comment is public and visible to the public. And we'll go ahead and get started. I want to start with you, Dr. Kurtani. And I'm wondering if you could kind of talk a little bit about what are some of the risk factors for head and neck cancer, and what does that cover? What is a head and neck cancer?
So, head and neck cancers are really kind of an umbrella term. In fact, HPV-related oropharynx or tonsillar cancers have now surpassed tobacco or alcohol-related disease. So it's kind of a growing epidemiology. Obviously, this is the same virus that causes cervical cancer and other cancers as well, that now there's a vaccine for. But alcohol, tobacco, and HPV are probably the most common risk factors for head and neck cancers.
And thank you for expounding on that. And Melody, I'm interested from your standpoint as a physician's assistant. How do you check somebody for a head and neck cancer? Because I do know we do community screenings quite often.
Yeah, so in terms of checking for these sort of cancers, number one, we can just do a clinical exam. So let's say someone has a spot in their mouth that isn't getting better, and if anything, the lesion's getting worse, it's becoming more painful, it starts to bleed. Those would be things that someone would want to get checked out, and it's something that a provider can do a clinical exam and see if this sort of spot looks suspicious. Also, if you are having other symptoms, or for example, like a lump that pops up in the neck, sometimes your provider will get a scan. And if, a scan also shows something suspicious or a neck mass, that could be another avenue to get checked out.
Um, and of course, as we always like to say, you know your body better than anybody. So if you notice something strange or off, obviously get that checked out. Dr. Yang, from a radiation oncologist perspective, I'm curious as to how radiation is used in the treatment of head and neck cancers, because as Dr. Kurtani was saying, they are kind of in a bunch of different places. Can radiation help in all cases? And if not, what cases is it used?
Yeah, so the radiation can be helped in quite a few cases for head and neck cancers. Radiation can be used by itself or with chemotherapy to cure head and neck cancers. It can be in conjunction with surgery, typically following a surgery, for other cancers that may have a surgical approach first. And I would say there's probably a role for radiation in basically every single head and neck cancer you can think of. It's one of the more sort of radiation-centered specialties or head and neck, you know, there's a lot more applications of radiation in head and neck cancers than say for, other specialties. So to answer your question, there's quite a few applications, both curative, upfront or following surgery, or even in the palliation setting for patients who have disease that can't necessarily be cured.
And thank you for sharing that. And again, I want to remind everybody who's watching, if you do have questions, please drop those into the chat. We'll do our best to get to those. And Dr. Kurtani, back to you from the surgical perspective. When is surgery an option for somebody with head and neck cancer? I know that's a very broad question because there's so many different variables and different types, but when is it typically when a surgery is required or is helpful?
Yeah, so as a medical oncologist, I probably will defer that question to Melody. Melody may be able to better answer that from the surgical side.
So in terms of surgical intervention, I would say most oral cancers, for example, cancers involving the tongue, the gingiva, buccal mucosa, a lot of these usually surgery is first line of treatment. I would say more cancers in like the tonsil region, the base of tongue, or in the throat. Usually, we do first line with other treatments such as radiation and or chemo. And then there's
And-
certain situations where if a cancer has spread past the collarbones or metastasized lower in the body, then typically we don't do surgical intervention. There's other avenues of treatment for that. And if a tumor in the mouth is very extensive, where maybe it's spread too far back, or if there's a mass in the neck where it's encasing the arteries and surgery is not the best option, where maybe the risks are too high, then at that point, sometimes we don't do surgery and we would refer to radiation and medical oncology.
And Dr. Kurtani, coming back to you from the med-onc side, if it's not surgery that is being used to treat head and neck cancer, what do you do from the medical side to assist these patients? And again, I know it's a broad question because everybody's case is different, but what is a typical appointment like?
Yeah, so there's a variety of uses for chemotherapy, and a better term is probably systemic treatments, because there's different types of IV or pill treatments that we can give to patients. Most prominently, chemotherapy is used for patients in conjunction with radiation to cure them. So in general, if someone has a primary cancer in their tongue or their tonsil and a lymph node involved, we many times have to add chemotherapy to the radiation. What chemotherapy does in that setting is actually helps the radiation work better. So while radiation acts as kind of the definitive cure, sometimes if patients have a little bit more cancer in their head and neck, chemotherapy really helps the radiation take care of things a little bit more strongly. That's probably the primary use of systemic treatments. And now, as Melody mentioned, sometimes we see patients who have disease below the collarbone or in their lungs or somewhere else. And generally, we will rely on other types of systemic treatments like immunotherapy in conjunction with chemotherapy to try to control the disease for as long as possible.
And when you mentioned chemotherapy, is this through infusion or is this an oral chemo, or is it depending on the case?
Yeah, usually it's given through an IV, regular IV in the patient's arm, and we coordinate it with the radiation schedule when we're giving it with curative intent. So yeah, with an IV. Now we have some clinical trials where sometimes we add oral pills and things like that, but primarily the treatment is through IV.
And I know with so many cancer treatments there are side effects, and Dr. Yang, we'll go back to you for this for the start on the radiation side, radiology side. What kind of side effects does a patient have if they are treated by you and your team? What can they expect?
So it's pretty specific, and it depends on where the radiation or where the cancer is located. So, but a typical range of side effects could include things like taste changes, saliva changes, skin changes like redness, peeling, irritation, mouth sores. We call that mucositis, and throat pain or discomfort. Fatigue is something that always happens with radiation, kind of regardless of the location in the body. But it really depends on where the patient's head and neck cancer is, how large it is, if they've had surgery before, and their overall status as well. So there's no catch-all, but there are sort of generalities and there are themes.
Of course, and I would assume that would be similar for other means of treatment. Dr. Kurtani and Melody, is there a common side effect to obviously surgery? There's a recovery time, things like that. But are there other concerns as far as side effects go?
So from a surgical perspective, usually people feel most of the side effects in that post-operative period. So within those first few weeks, first few months after surgery, specifically in the mouth. Our mouths are obviously very important for eating and speaking. And so people might notice some changes, being able to speak. Some people might notice a lisp when they talk. They notice that their swallowing and their eating in general is different, where maybe they have to do more of a modified diet for some weeks after surgery, with liquids and pureed, soft sort of stuff. Long-term side effects, depending on the type of surgery, if it was more of an extensive surgery and if people have, for example, scar tissue or even some sort of reconstruction, some people might notice some changes there with eating and swallowing as well. But usually we have our patients work with our speech therapy team to help improve those symptoms and their long-term side effects.
Understandable. And Dr. Kurtani, I think you were going to add something as well.
Yeah, so it really just depends on the type of systemic treatment that we give. Common things being common, we look at blood counts, which can get low with certain types of systemic treatments, nausea, fatigue. One of the more common chemotherapies that we use can cause some ringing in the ears or hearing loss, and also some kidney issues. So we really have to really closely monitor patients whenever they're getting any of these treatments and try to work with them to try to get their symptoms under control, particularly as it relates to nausea and fatigue.
Course. And this is a great question that just came in through our Facebook Live. Can I do any at-home tests to look for areas of concern, or can a dentist see potential issues? Are those two ways in order to discover if there's a head and neck cancer?
Yeah, I would say both of those are good options. It's pretty common for people to get little ulcers in the mouth and inflammation, but the key is are those spots getting better? And if the answer is no, and especially if it's causing you some concern and symptoms, you can get it checked out. And I know also with dentists, even just usually when they're doing your regular cleanings like twice a year, they'll kind of keep a lookout in your mouth. And if they see something weird or suspicious, they would let you know about it.
And I know that there's a lot of talk in all different cancer types about genetics and its role in cancer. We hear that a lot, like with breast cancer, for example. Is there a genetic connection for head and neck cancer patients? Does it run in families? Is there any information around that? And I'm not sure who to ask that one to.
I could probably take that. So the answer is mostly no. There are some rare syndromes that predispose patients to develop these head and neck squamous cell cancers, but the large majority of the cancers that we all take care of, cancer patients that we take care of, have some exposure, whether that's HPV, alcohol, or tobacco. So less likely to be a genetic phenomenon, but again, that's a very rare circumstance where that could be technically true.
Okay. So is it safe to say that obviously making healthy choices is one way to prevent yourself from getting head and neck cancers? And early detection, we hear all the time, is key to so many cancer treatments. I'm assuming that's the case here as well with head and neck cancers.
Yeah, I'll kind of start and maybe the others can add, but yeah, early detection is always important. There isn't, necessarily an equivalent screening test for head and neck cancers as there is for breast cancer or lung cancer. We do head and neck cancer screenings here at Moffitt, and we kind of go out to the community to do those screenings as well to check for lumps or bumps. But really, if something is persistent and progressive, that you really should get seen by a doctor as soon as possible to make sure that it is not cancer, which is, of course, the large majority of lumps or bumps. But it's really important to try to catch these types of cancers early because they are very treatable for the most part and curable for the most part, I should add.
Which is great news. And to kind of follow up something that you said earlier, Melody, like if you're doing your dental checkup and they see something of concern, is that when you go to your general practitioner first, or do you go straight to a cancer specialist? What is your suggestion when that happens?
So if a dentist were to see something in the mouth, for example, like a white patch, and maybe they think it might be something like a leukoplakia, which can be a precancerous oral lesion. Sometimes they'll go ahead and just refer a patient over to an oral surgeon so that they can do a biopsy. If that doesn't happen, then you can see an ENT doctor, which is an ear, nose, and throat, and they can also evaluate you and potentially biopsy if they have concern. And then in terms of being seen at like Moffitt specifically, or a head and neck cancer specialist. We do see these sort of precancerous lesions in the mouth, and then also, of course, cancerous lesions. But unfortunately, at a cancer institute like Moffitt, we don't see more like inflammatory sort of stuff. So usually it's better to start with an ENT if that's the case, because they can better manage it. But if there's something of concern, like a precancerous lesion or a cancerous lesion, then we would definitely be able to check you out.
And I know this was mentioned earlier, and this was a question in the comments as well, around HPV. And I think, Dr. Katani, you may have mentioned this earlier. If someone has been told they do have HPV, is there a different regimen they should go through to get checked regularly for head and neck cancers, or should they just make it a yearly screening? What would be your recommendation in that case?
So for most patients that have encountered HPV in the past, it doesn't necessarily mean they're guaranteed to have a head and neck cancer. We know this is a very common viral, sort of thing that people encounter in their teens and early 20s. And for the vast, vast majority of folks, their immune system takes care of the virus and it never becomes a problem again. Um, that being said, it can cause sort of head and neck cancer, cervical cancers being the most common variety. And the most common presenting symptom is, as we've been talking about, a lump or a bump or a spot that hurts or doesn't go away in the last sort of weeks to months. And so, kind of echoing what the others have said, maintaining awareness of what's going on in your mouth, neck region, and having the wherewithal to, or ability or an understanding to go see someone when something like that appears is important. But there's no specific screening mechanism currently.
And to follow up on that and going more into the treatment side, Dr. Yang, from a radiation perspective, I was wondering if we could touch on that a little bit about what that experience is like for somebody. What is the radiation? Are you like in a CT scanner? What is that like for somebody? Is it an ultrasound thing? What is that experience like?
Yeah, so for radiation, usually after a visit with a doctor, the next step would be something we call a CT simulation or radiation treatment planning session. It's where we make a CT scan mapping of the patient. We do that by using a mask that stretches over the head, neck, and shoulders. It keeps them in the same position for all of their treatments. Then someone like myself, a radiation oncologist, would identify where the cancer is, identify where the normal organs are, and develop a radiation plan that we can use to safely and effectively treat the cancer while trying to spare the other organs nearby. That usually takes some time, usually between 10 to 14 days. And then once the radiation actually starts, it's typically 5 to 7 weeks in length, something of that sort. And the radiation treatments themselves are putting patients back in that same mask, having them on the table, and the treatment machine rotates around them, delivering the treatment as prescribed. So the treatments themselves, they used to be 45 minutes long each. Now I think we've been able to shorten them down to 8 to 10 minutes in that ballpark. So
And this is usually like a weekly treatment, or again,
radiation is typically Monday through Friday, although there are exceptions where folks will come in for 6 treatments a week, or less common scenarios where they come in for 10 treatments a week, twice a day. There are a variety of treatment delivery methods, and so each has its own scenario and particular use area.
And this is a really good question that just came in, and one I was wondering as well. With Moffitt working on our Sparrows campus and proton therapy coming in, is proton therapy ever an option for head and neck treatment in this case, or is that something else?
Yeah, so protons I think are a reasonable option. I think there hasn't been officially published data yet, although I think there are some larger trials that will soon be published. But not all cases are suitable for protons. Not all cases are a good idea for protons to be used. It really depends on the discretion and understanding of a particular patient's anatomy and case. And every case may vary. It's just hard to say, right? There's no way to say that protons are going to be better than photons for all head and neck cancers. That's certainly not the case.
Of course, which goes back to personalized medicine. Everybody's case is different. And earlier, Dr. Kurtani said that head and neck cancers are preventable, treatable, and often curable. I'm curious about post-life as a head and neck cancer patient. And this question is for all three of you. I know you've treated a variety of patients. Can a person who has gone through head and neck cancer treatment have a quote unquote normal productive life after that? Or is it kind of a life-altering thing? Or again, does it depend on the situation?
I can start maybe from the medical oncology side of things. I think no one is the same after any sort of treatment, right? So a lot of our patients I would say the majority live very nice, fulfilling lives after treatment. It really just depends on where their cancer was and how it got treated. But for the most part, people can have really good, productive kind of life afterwards. The side effects, at least from my side of things, some people can have a little bit of low blood counts long term, which they don't really feel. Some people can have some mild ringing in the ears or hearing loss. But usually the nausea has subsided by then. Sometimes people who get other types of treatments like radiation that I'll let Dr. Yang talk about can have some taste changes. But long-term patients can do really, really well. And that's kind of the nice thing about the cancer that we take care of is nobody wants cancer, but we really can cure a large majority, not all, but.
Yeah. And Dr. Yang, did you want to expound upon that when Dr. Katani mentioned the radiation?
Yeah, probably the most prominent long-term side effects are going to be taste changes, so things just not tasting the same as prior to cancer treatment, and decreased saliva. So sometimes with either radiation or surgery, the salivary glands can either be removed or affected, such that the normal thin saliva that we're used to doesn't really exist anymore. Other folks can have scar tissue in the neck that can cause over a long period of time, we're talking years, some decreased mobility. Every now and again, radiation can affect the thyroid function and cause it to not work as well. But these are, with the exception of, I would say, the taste and the saliva, these other side effects are somewhat less common. But are going to be something that patients will have to live with and adjust to a new normal in many cases.
Of course. And Melody, I want to give you a chance to answer this question as well, because I know you work with a lot of different patients. What is your perspective on this? Life after head and neck cancer?
Yeah, I would like to mimic what Dr. Yang said, where it's kind of a new normal that patients usually experience once they're healed from all of their cancer treatment, where maybe there might be certain things, kind of like I said before, with speech and with eating, where it might not be what it was before, but it's a new normal where people are able to still function and do what they want. I know I've had patients before with concerns of, I like to go out to restaurants and I like to socialize and all of these things. And sometimes being diagnosed with these oral or throat cancers can be scary, and people might think that maybe they might not be able to do those things in the future. But I would say most of our patients, once everything is done with, they're able to do those things. It just might be a little bit different.
And I wanted to go back to the screening process. Coming up actually this Friday at Moffitt Cancer Center, there's going to be a screening event for head and neck cancers on campus. So I'm curious, and I'm not sure which one of you wants to answer this, but if somebody has not had symptoms but shows up at a screening event, what is that experience like? I know there's a lot of hands-on feeling for things. Who can answer that question and kind of let us know what that would be like from a patient perspective?
I can answer. I'll be there this Friday. So
Okay.
with the screenings, usually we ask basic questions. Are you having any symptoms? Are you having anything new or concerning to you? And then we do a basic head and neck exam where we will palpate the neck. We see if we feel anything abnormal, like enlarged lymph nodes, thyroid nodules. We look in the mouth. We inspect for anything suspicious or weird going on. And if there is a finding, we make a recommendation, whether that be, follow up with a dermatologist if there's a suspicious skin lesion, or if there's something in the mouth, we might have you recommend you follow up with like a local ENT doctor. But I would say even if you're not really having any specific concerns, it doesn't hurt to just get checked out for a basic head and neck exam, because sometimes these things aren't even symptomatic. So just having a specialist do an exam can rule out anything going on there.
I think that's really, really good advice. And like we said earlier on in our conversation, we all know our own bodies and can usually tell if something's off, but not always. So it's always good to kind of have somebody check you out. Dr. Kurtani, if there's somebody can't come to a screening event like the one we're doing here at Moffitt or when we're out in the community, can a general practitioner check for head and neck cancers? Is that something that they usually do?
I think a lot of our referrals, this is more directly to the surgeons, so Melody's side of things, come from general practitioners who have evaluated a patient and they feel a lump on the patient they're seeing and get a scan and something's abnormal, and then they send them over to the Moffitt side of things. I don't usually see those direct referrals unless there's a diagnosis, but yeah, I think general practitioners, even patients themselves, they're concerned, can ask their GP for evaluations and things like that.
Now, as we kind of start wrapping up this conversation, it is April 1st, and it is Head and Neck Cancer Awareness Month, which is why we're having this conversation. But I'm interested, this question is for all three of you to think about, you know, what are some of the things that people, either patients have asked you about when it comes to head and neck cancers that may not be well known, or some of the common concerns, or just general messaging that you would like to get out to anybody watching this who does have concerns about head and neck cancers. And Dr. Yang, you're the one next to me in my little Hollywood squares here, so I'll ask you to go first on that.
Sure. This is more relevant for patients who are undergoing treatment. I've heard recently a lot of concern about sugar or just sugar intake in general as it relates to folks getting head and neck cancer. I just want to put it out there. Sugar is not a driving cause of head and neck cancers. For patients that are undergoing treatment, whether it's surgery, radiation, systemic therapy, we want folks to eat. Losing weight is way worse than eating some sugar. Sugar is an easy way to get calories in, and it's just something that I've heard from numerous folks. I think there's a lot of information out there that may not be relevant to head and neck cancers, and particularly for folks in treatment, but it does scare people away from maybe getting the calories that they need or should be getting.
Thank you for bringing that up. We hear about sugar all the time, so thank you for mentioning that. Melody, same question for you. Any tips or advice or parting thoughts about head and neck cancers?
I think I would just say if you're having any doubts, even if you're not sure, to just get checked out, go to your general practitioner. If you're specifically having like an oral or throat concern, maybe see a general ENT just to see, because as we were saying before, early detection, if possible, would be ideal.
Yeah. Of course. And Dr. Kurtani, I want to give you an option to weigh in as well before we say goodbye. Any tips for anybody watching from your perspective?
No, I kind of echo Melody and Dr. Yang's comments. I mean, advocate for yourself, get seen by your doctor if there's something concerning. And I will add one thing that head and neck cancers are, although this is all we do all day, every day here in this department, we see a lot of patients, but it's not the most common of cancers. It's about 3% of US cancers. So the overarching likelihood of something in your neck is not cancer. However, it's important to get it checked out because the earlier we detect it, the better chance of cure. So really advocate for yourself, see your doctors, talk to them about it, and then see us if needed.
And you remind me of one more follow-up question that I had for you, or actually any of you. I've talked to other doctors in other departments about different types of cancer, and while the internet is a great resource, a lot of times I hear, don't let Dr. Google diagnose you. So I wondered if one of you could comment on the importance of taking the information out there with a grain of salt, for lack of a better word, because I know it's easy to kind of go down that scary hole.
Yeah, I mean, I think the best resources come from reputable sources. So, major health organizations, academic centers can provide you the most up-to-date research and just in general information on this type of cancer. Try to stay away from other kind of non-reputable sites. That's probably the worst way to increase anxiety and concern about treatment and a diagnostic issue. So just try to stick to major academic organizations or healthcare organizations.
Thank you for that. I think that's really excellent advice. And I want to thank everybody who was watching today and asked those questions. We really, really appreciate it. And of course, I want to thank all three of our experts for joining us today, for sharing their expertise and answering my questions about head and neck cancer as we head into Head and Neck Cancer Awareness Month. Remember, this Friday, we are doing free head and neck screenings at Moffitt Cancer Center on April the 4th. Check out moffitt.org for more information about that. And of course, if you do have questions about your own health or do want to make an appointment, you can contact moffitt.org as well. Again, thank you, Melody, Dr. Kurtani, Dr. Yang, all for taking time out today to talk to me about Head and Neck Cancer Awareness Month. I really appreciate it.
Nice
Thank
talking to you.
you.
Thank you all.